Absolutely. So first of all, the reason we undertook this study is that the standard of care for early stage breast cancer is breast conserving surgery, which is done in about 60 to 70% of patients with the addition of adjuvant radiotherapy and primarily to prevent local regional recurrences. However, we know that only 3 out of 10 patients get the optimal therapy this way. And that is because 6 out of 10 patients will be recurrence-free without any radiotherapy, and about 1 out of 10 will develop a recurrence even with radiotherapy. And the challenge is, of course, to know beforehand who will benefit or not from the therapy. So the overall hypothesis was the gene expression analysis of the tumor could help determine this. And the aim of this particular study is to use gene expression analysis of the tumor to identify patients with such low risk of local renal recurrence that they can safely be omitted radiotherapy. And to do this, we analyzed data from the BPCG91RT randomized clinical trial, which randomized patients operated with breast conserving surgery to receive either adjuvant radiotherapy or no radiotherapy, and for which 764 tumors had been profiled for gene expression levels. And we restricted the analysis to ER positive and HER2 negative patients, as they would be the most likely candidates for therapy omission. We also restricted the analysis to patients without systemic adjuvant therapy in order to assess the pure prognostic information and the radiotherapy specific treatment effect without confounding from other therapies. And to develop the actual gene expression signature, we split the patients in a training and a validation cohort, and we developed a 16 gene signature that was based on local renal recurrence risk and biology associated with local renal recurrence in the training cohort. The signature was then locked and tested in the validation cohort. And we named the signature the Profile for the Emission of Adjuvant Radiation, or POLAR for short. In the validation cohort, POLAR low-risk patients had a 10-year local renal recurrence rate of 7%. And POLAR was prognostic also after adjusting for patient age, histological grade, tumor size, and molecular subtype, showing that it provides additional prognostic information. And importantly, the POLAR low-risk patients had no benefit from adjuvant radiotherapy, while the POLAR high-risk patients had a substantial benefit from radiotherapy. So in conclusion, POLAR may identify patients with early stage breast cancer with such low risk of local renal recurrence that omission of adjuvant radiotherapy could be considered. So that is a very good question. One of the limitations of this study is that patients were not treated with systemic adjuvant therapy. And this provides an opportunity to analyze the pure prognostic effect and the specific effect of radiotherapy. But it makes it a bit more challenging to interpret the absolute recurrence rates with modern systemic therapy. However, the local renal recurrence rate will most likely be lower with adjuvant systemic therapy, meaning that the rates in the BPCG91RT trial are probably conservative estimates of recurrence rates. So the clinical implications of this study are that if further validated, POLAR could provide a tool for clinicians to personalize radiotherapy for early stage breast cancer patients operated with breast conserving surgery. That would mean that only patients that really benefit from therapy will receive it, and those without benefit would be spared unnecessary therapy with potential side effects. So gene expression analysis of breast cancer has already changed the way we administer adjuvant systemic therapy to breast cancer patients. And that means personalized treatment decisions to increase benefit and reduce toxicity for the patients. And our hope is really that this study will help moving the field towards personalizing also radiotherapy for every patient.